The Mannin Line with Andy Wint.
Good afternoon. Welcome to Mannin Line on Manx Radio. Lawrie Hooper, MHK, is on. If you want to get in touch and speak to the Minister at the Department of Health and Social Care, text 166 177, email studio@manxradio.com. You can WhatsApp on 166 177 or call 66 13 68. First elected in 2016 for Ramsey, and a multiple minister, it has to be said now. And so, first of all, good afternoon, Lawrie Hooper.
Good afternoon.
Here we are as DHSC at the moment, principally, Lawrie Hooper. What's the biggest challenge on your desk at the moment?
Funding, if I'm perfectly honest. That's definitely the biggest worry that I've got at the moment for our health service is making sure that we have enough money to actually deliver all the services that people expect and all the services that I know staff want to deliver.
Okay, the financial year obviously finishes the end of next March, isn't it? So how are things looking between now and March?
So we knew it was going to be difficult. If you look at last year, Manx Care were about 9 million overspent, which, to be fair, isn't all that bad considering the scale of the budget and the challenges they've got. But even now, we're still forecasting, and Manx Care are forecasting being overspent already at this point in the year. And in part, I think that's because the funding that's been allocated just hasn't been sufficient in recent years. I still don't think it's at the right level. If you look at the independent health report that we got from Sir Jonathan Michael, that said we should be investing more than we currently are. So what we're essentially trying to do is deliver a health service almost with those financial hands tied behind our back, which does limit our options in a lot of ways.
You qualified as a chartered accountant. With your chartered accountant head on, how do you see the future?
It's a difficult one, if I'm honest, for health and care, because I think there's a growing level of demand out there and a growing expectation. But at the same time, government is trying to row back on funding and on these overspends that we are seeing left, right and centre. And I think the problem we've got within the health service is because it has been underfunded for so long, they're already almost cut back where they can. So now if you are looking to make cuts, essentially, I know we use the word efficiencies in politics a lot, but the reality is there are efficiencies to be made, but they're not going to release cash into the system. Efficiencies generally mean you can see more people with the same amount of money. That's definitely going on, but equally there is this requirement, I think, from government to say you can't keep having more and more money every year, and what that really means in practice is making difficult decisions about not enhancing services, or in some cases stopping doing things that we've always done. It's not a comfortable place to be in, if I'm honest.
Okay, Howard's first with us on Mannin Line now. Faster Mike, good afternoon, Howard. You're live with Lawrie Hooper.
Good afternoon, Andy. Good afternoon, Minister.
Good afternoon.
First of all, a pat on the back. Many years ago, they used to do a procedure for the injection into the eye for age-related macula at Nobles Hospital. For whatever reason, it was stopped. But recently, they have gone back to it and doing the injections in Nobles Hospital, which to my wife is a great relief because the travel, I can't fault Aintree or the travel arrangements, anything connected with it was all first class. It's just that it was over and done with so rapidly at Aintree Hospital. They had a whole day to sit in Liverpool with no means of getting back home until, around about 9 at night. But now that they've done this and it's in Nobles Hospital, we can be back in our own home within a few hours. So the DHSC has got to be congratulated on that. It is a very useful means and a very supportive means for the people that's travelling away, because you can't get trapped on the other side. Here, it's a great relief that you're within a short distance of home. But what I was going to come on for, and I'm just reading the paper this morning, this has taken away the ministerial side. We're just going to you as an MHK. Rishi Sunak now has said that he's going to release more licenses for drilling for gas and for oil off the North Sea. Now, we've got our own little problem here with Crogga. Are the government, the present government, still dragging their heels on the regulations which are preventing this privately funded company from introducing oil and gas revenue to the Isle of Man coffers, which is badly needed? Are they going to change their mind now, the green scene, and allow and to build up the regulations on the licence to drill within the Isle of Man?
So I don't know much more about that than you might do, if I'm perfectly honest. So my personal position on this has been quite clear. I don't support drilling for additional gas or oil. I don't think it's the right thing to do. I don't think it's necessary, and I actually think there are much better ways of raising the revenue that we need. But from a government perspective, I think this is where I'm at odds with some of my council ministers' colleagues, because my understanding is government is still progressing with that as they always have been. So I'm not really cited on the detail, but my understanding is things are going ahead as they always were. I don't think there's been any particular issue with that, but from my perspective it is still the wrong thing to do, but like I say, I'm not really involved in that part of the process, so what know as much as I do.
What's your objection to it?
The objection's manifold, if I'm honest. So partially it's around the climate side of things, and actually the impact that it would have not just globally but also locally on us here, but partly it's also because if you look at the detail around the sites that could be leased for offshore wind farms versus gas and oil, I think there is a conflict there as well, and I think we'll make more money longer term out of doing the seabed leasing properly for offshore wind and for other kind of offshore developments, as opposed to the gas and oil extraction. So I think financially it's the right thing for us to do. I think economically it's the right thing for us to do, and I think from a climate perspective it's the right thing to do, and the wrong thing to do, because it would scupper all of those things, actually we're going out and drilling for oil, so or gas in this case. So I think I've been quite consistent on that one over the years. Sorry about that.
The thinking now amongst the eminent scientists and people are saying that this fossil fuel is not a fossil fuel, it is self-generating, and it's generating all the time. So the short term that they're talking about for fossil fuels of their life, they may just have to look at a new patch, but fuels are being regenerated underground, and they won't have to be taken down every 25 years and leaving scars all over the place like wind farms. So they're dismissing the oil and gas and then going for wind farms, which to me is a complete waste of money, because wind farms, as the term implies, only act when the wind is working.
Yeah, I mean, that's pretty self-evident. I would accept you on that the wind farms definitely only work when the wind is blowing. We're quite a windy island, so I don't think I've got any huge concerns in that regard. If you look at what's happening off the Scottish Islands, for example, they've got extensive offshore wind farms generating quite a lot of revenue for the Scottish Islands, for the Scottish government. And actually, there are some islands now that are almost entirely renewably powered. I mean, they're a lot smaller than the Isle of Man, don't get me wrong, but it shows that in principle it can work. So, yeah, I think we'll just have to agree to disagree on that one.
So do you think you're talking about leasing our 12-mile bed offshore to companies like Ørsted or whoever it's going to be? We can make more money leasing our offshore bed than we would from Crogga, you think? I
think long term, yeah. I mean, Crogga is a limited time period anyway. I think everyone, even the people that are very much in favour of doing it, acknowledge that it's going to operate for a period of time and then it's going to stop. But actually, if you look at longer term leasing of seabeds and options arrangements and all the other things that have been happening across the Crown Estate in the UK, the people that manage the territorial seas for the UK, actually there is a significant amount of money that can be made whilst also still ticking all the boxes around climate and environment and everything else, as well as, of course, providing us with an element of energy security, which is quite critical for us as an island.
OK, all right, thanks, Howard.
OK, thanks, Andy.
Good to hear from you, thank you. I want to go to Mary now, who's with us. Good afternoon, Mary.
Good afternoon.
Now, you live at Cummal Mooar, don't you?
Yes, I do.
OK, you're with Lawrie Hooper.
Thank you. Hello, Mr. Hooper.
Hi there.
I'm concerned most of all about Cummal Mooar home. It is a home, and it's a home to the residents who live here. We are treated as if it's our home. People are so kind to us and so good. I can't tell you how much I enjoy it. All the worry is taken off our backs, and very, very easy for us to cope.
Okay, all right. So in a nutshell, Mr. Hooper, the story is that Cummal Mooar will be closed at some point, and there's some confusion. Is there going to be a replacement, or is there not?
So I'd just like to say thanks very much for taking the time to call in. I mean, I really do appreciate that Cummal Mooar it's first and foremost, it's a home, somewhere where people live, and I think you've got to remember that whenever you're talking about these issues. I think the challenge we've got from a Manx Care and DHSE perspective is the plan, I don't think, has ever changed. So, we knew that Cummal Mooar isn't fit for purpose as a building. It needs to be replaced. That was always on the cards, and that's why we put in a planning application a few years ago. It's why there was budget bids to Treasury asking for funding. The intention to replace that facility with a new facility is still very much there. So the plan itself hasn't changed. Cummal Mooar at some point in the future will close and it will be replaced with a different building. What's happened now is it's almost like we're in this grey area where we're not quite sure when that's going to happen. And partly that's because we didn't get the funding approved from Treasury like we were hoping to in the budget this year. Partly it's because we've been told to go through this new Treasury process, which has given us the opportunity, I think, to double check what we're proposing to build is definitely the right thing, but ultimately it's also because running Cummal Mooar as a home is costing Manx Care quite a lot of money every year to keep it operating. So for every year that this is delayed by, it ends up costing us quite a bit of money, and so really it's in everyone's interests to get this resolved quickly.
When's it going to close?
And that is the, in this case, multi-million-pound question. Unfortunately, is Manx Care have obviously made this decision that they've announced. I'm not quite sure it's as black and white as that. So my intention, as I've said a few times already publicly, is my intention would be to see if we can keep Cummal Mooar open until the replacement facility has been built. That is definitely what I'd like to do. So that's the conversation I'm having with Manx Care at the moment, is to say, how do we make that happen? How do I make sure that we keep the facility open whilst we are getting the new facility up and running and the new approvals?
This place to come into because we know what it was like, and they think things surely could be updated. Not spend on a new building. Why can't you just update the existing one that's here?
So I think that was looked at in terms of what is the most cost-effective way of doing this, but the facility itself as a building is pretty out of date in terms of modern standards. So you'll know yourself, for example, that not all the rooms have en suites. There are all sorts of challenges around the building. So one of the options that was considered 5 years ago, I suppose, when they first started looking at it, was, can you just rejig the building as it is? And the answer to that question seemingly was no, you can't. And so the best thing to do is to build a new one, and that's what was planned. Has been in the plans now since about 2018, I think, was when the original decision was made. So this has always been the case. It's always been the plan to say, let's have a facility in Ramsey. In fact, the plan was to build it literally on the site next door to Cummal Mooar. That was always the original intention. That was something that had been discussed with Ramsey commissioners. So it was this idea that it's going to close has always been the case. The problem we've got now that's kind of come to the fore in the last week or so is when might that happen and what's going to happen in the interim. And so what I'm trying to do is provide people like yourself who live there with some reassurance that says, I'm working on seeing how we can keep the building open whilst we get the new build up and running.
This building and other buildings like it, and come in and see us and how happy we are and how well we're cared for. We're looked after very, very well indeed. And also our meals are good, which we can't do for ourselves.
Okay, all right, Mary, we appreciate your call. I think at the bottom of this, Mr. Hooper, is the fact that you understand the ins and outs of the politics, you understand the finances probably better than most people, but to the residents, it's a home.
Yeah, and I think
there's an emotional bond to something like that.
Yeah, and I think that's a fair comment. And I think when this was most recently discussed with Manx Care, I think we talked about it in April time. The instruction or the agreement was there would always be a comprehensive piece of work to be undertaken with the staff, with the residents, with the local community, to make sure that everyone was fully informed and involved in what was going on and any decisions that had to be taken. And that's where I think something has fallen by the wayside, in that hasn't happened, or at least it doesn't seem to have happened. And so what's happened instead is we've kind of got some information being given to some people and different information given to others, and I think that's part of the problem. So I think the next step of this now really is to get back around the table, understand exactly what the situation is, and then make sure we do bring in the residents, the staff, the local community, the commissioners, and make sure everybody is on board, because like I say, the plan is very much to make sure we do have a new Cummal Mooar, as it were, in Ramsey. But at the moment, the big question is, well, when is that going to happen? How quickly can we make it happen? And all of that really does come down to when are Treasury going to approve the budget and how much are they going to let us have?
Okay, all right, Mary, we appreciate your call. Thanks for being with us today. And Mr. Hooper, we come back to the money again, the money situation. In your head, have you any time scale as to when Cummal Mooar will close?
Unfortunately,
2
I don't.
years, 3 years, 5 years?
So Manx Care have said 2 years. My understanding of the way that the Treasury capital processes can work is even if we get everything done and dusted and approved really quickly, it's still going to take a couple of years to get that through the process and actually out the other side. So you could very well be looking at longer than 2 years, but ultimately that will depend on whether or not Manx Care can afford to keep the facility open. And those are the conversations that I'm trying to have right now, is to work out where are we with this, and actually how do we do what's right for the residents and for the staff and for the people of Ramsey, because ultimately that's got to be the main focus here. It's got to be about the people and not really about the money.
A message in now from Heather, who says lung cancer is the biggest cancer killer in the British Isles, mainly because it's often advanced before it's detected. Manx Care advised it was monitoring advice and guidance from the UK before planning implementation of a local screening programme on the island. In June 2023, the British government, last month, the British government announced the rollout of a targeted lung cancer screening programme. Is there going to be one on the Isle of Man?
So the UK's lung screening programme is quite interesting because they've announced it, and the UK government has a habit of doing this. They announce something that sounds great, but actually when you look at the detail, it's going to take years before it comes into force. So the UK are actually saying they're not going to be covering the population that they've outlined until 2030. So it's going to be a number of years before they actually get round to offering the scans to everyone they've included in their press release. So Manx Care have got an action in their mandate which says very specifically they are to conduct a gap analysis against UK standards for screening programs, and the idea is to understand where we are versus where the UK is, and then propose what we've called a remediation plan, which is essentially tell us how you're going to get us from where we are on the Isle of Man to where best practice, where the standard is. So yes, I think the reality is this is something that will be coming down the line on the Isle of Man, in the same way that we're looking to upgrade and make sure that all of our screening programs are aligned with UK best practice. But we would just caution people about taking the UK press release at face value, because actually when you look at the detail, it is something that's going to be gradually introduced over a period of the next 7 years, and I think in reality it gives us some time to understand where the UK are, where they're going, and then how we can make sure that we've got the same service on the island. Okay,
a text in from Anne on 725. Could the Health Minister tell us whether or not he supports the assisted dying bill? If he does support it, does he believe it's safe, bearing in mind it has slippery slopes, that's led to slippery slopes in countries where it's been legalised? From Anne.
Thanks very much for that. That's an interesting question. So I've tried to stay out of the public debate on this because of my role as Minister for Health, and I wanted to make sure that whilst the bill was being consulted on, people didn't feel pressured one way or the other, having the Health Minister weigh in on the debate. Now that's happened and the consultation is finished, and Dr. Allenson has introduced the bill into the branches. I think it's probably safe for me now to talk about where my feelings are personally, and this is to get me as an individual, not really me as the Minister. As an individual, I do support the principle of introducing an assisted dying bill. I do. I think it is absolutely the right thing. I think it's fundamental that people have that choice and have that right. The fundamental question for me, though, and the bill itself doesn't spell this out perhaps in the way that I would like, is around the safeguards. How do you make sure that it really is that person's choice, and that it isn't being pushed on them, or they're not being pressured, or it's not being done inappropriately? And that's my next step now, is to go through Alex's bill in detail, line by line almost, and say, actually, does this feel like it's going to work for us as an island? And that's with my kind of MHK hat on. With my Health Minister hat on, I need to look at the bill and get staff to look at the bill in terms of what impact this is going to have on the health service, because one thing we want to make sure is I don't want something passing into law that it turns we can't actually deliver, we can't function. There's also questions around things like conscientious objection and opt-outs, and there needs to be a process that protects healthcare staff and health workers and making sure they're not feeling pressured into offering or providing a service that they fundamentally may disagree with. So it's a really complex question, So I think as Health Minister, I've got a certain set of concerns. As a backbencher, as an MHK, I've got a certain set of concerns. But broadly, I am in support of what Alex is trying to do.
Do you think Manx Care would be administering this service were it to pass into law?
So that's the reality. Is I think if it was passed into law and it was mandated by law to be an NHS service, then it would be delivered by Manx Care. The question then becomes, is it delivered in Manx Care facilities? Is it delivered at home? How do you make sure that staff get the right training and the right support? How do you make sure that staff who want to opt out from conscientious reasons can do so? It has a lot of questions around how it would be delivered. But I think if it's not mandated by law to be an NHS service and it's a private service, then obviously it wouldn't necessarily be Manx Care delivering it.
OK, you have a third hat as well, a Liberal Mannin hat. What do Liberal Mannin say about assisted dying?
So I think it's fair to say myself, my party chairman, and broadly my party are supportive. I think as a party we have the same concerns I think that your listener expressed in terms of making sure the right safeguards are in place. It's not a unanimous view in the party. We've never taken a formal political stance on it because I think there is quite a bit of disagreement amongst our party members on exactly where we should stand. But I think it's fair to say that we would support broadly the introduction of this, but there need to be the right safeguards in place. And like I said, that isn't the view of my whole party. That's my view. I know it's the way my chairman feels, but it's not necessarily the view of everybody in Liberal Mannin.
Lawrie Hooper, MHK, is on Mannin Line today. We're on till 1. And if you want to get in touch, text, email, call and WhatsApp.
Ramsey Garden Centre opens 7 days a week for roses, shrubs, trees, perennials and an array of pond plants. Or if it's fire pits or solar lights, there's never been a better time to visit Ramsey Garden Centre.
When you need a fitting memorial or headstone for a loved one, contact Manx Memorials in Peel. This long-standing family-run Manx company offer a wide range of granite and marble headstones and memorials, along with an island-wide inscription and renovation service. Manx Memorial's skilled professionals will take the time to help you choose a suitable memorial, and we're proud to say we'll beat other local quotes. Call 843 861 or email matthew@manxmemorials.co.uk.
You look happy.
I am. I'd worried about what could happen to my family if I die or can't work, so I've arranged a protection policy with financial options.
Sounds great, but it's another monthly cost.
Yes, but cover starts from as little as £5 a month, a small price to pay for financial peace of mind.
You're right.
Call Financial Options on 612 611 or check out financialoptions.co.im.
Chase Financial Services Limited, trading as Financial Options, is regulated by the Isle of Man Financial Services Authority.
On Wednesday evening at 7 p.m, Her Worship the Mayor, the Lieutenant Governor, the Chief Minister, Chief Constable and Chief Fire Officer and other dignitaries will gather at the Kay Memorial Gardens at Summerhill. At 6 p.m. on Manx Radio, a programme will recount the events of the night 50 years ago when fire swept so disastrously across the giant complex at Summerland.
The Summerland story, its aftermath and legacy will continue for years to come.
Wednesday evening, Manx Radio and the Nation remembers.
The Mannin Line with Andy Wint.
29 minutes after 12. Stephen, good afternoon. You're live with Lawrie Hooper, MHK.
Good afternoon, Andy. Good afternoon, Minister, and good afternoon, listeners. Lawrie, I would just like to take us back a short step. And a couple of weeks ago, you announced in the pay awards and with the current dispute over pay settlements with the nurses that there was no more money available, and I think that was probably the line that the department or the finance minister was running. But what we found then was that the Home Affairs Department, via the Treasury, I believe, contingency fund, were able to find money for the police with a one-off payment and still a rise. Now, I think this seems to be a little bit, it doesn't seem to show a united front from the government ministers. And do you feel aggrieved that you've held the line by saying there's no more money available, and yet for another department who are having equally the same problems that you are in retention, have been given a substantial pay settlement? So my question to you is twofold. Do you feel aggrieved, and do you regret saying there's no more money available?
That's two really good questions, actually. So the first question, do I feel aggrieved? Not really, actually. I think police officers definitely deserve a pay rise, so if they've gone ahead and managed to secure one, I don't have any issues with that at all. In terms of the no more money available, it's an interesting one, because originally the pay offer from Manx Care, not from the department, from Manx Care, was for 6%. We did then manage to go back to Treasury and secure some extra funding for the £1,000 lump sum that was then offered, but that was then rejected by one of the unions. I think my understanding is all of the other medical unions have accepted that pay offer, but it was the RCN specifically that said no, we don't want it. So we did manage to go and secure some additional funding to add to the pay offer that Manx Care had made, but then that was rejected by the union. So it's not quite as straightforward, I think, as saying one set of people got money and the others didn't. Actually, money was put on the table for both groups. In this case, one group has obviously accepted it and another group hasn't, and so that isn't really something I've got a lot of control over, unfortunately. But we did go back and we did manage to secure that additional resource, but like I say, it just unfortunately wasn't accepted by the staff side.
I suppose really the follow-up question would be to the parties who did agree is, do they now feel aggrieved that they settled for £1,000 and yet another public sector worker has managed to secure further funding of £2,000 per person? So I suppose it does, to me, it shows us cracks within Coleman and cracks within the government policy. So thank you for your reply. I know you can't answer my last question, but thank you very much.
Okay, thank you, Stephen. Good to hear from you today. A question for DHSC Minister Hooper from Margaret. In my experience, the Manx Care complaints procedure is very protracted, and complainants are often subject to delays, prevarications and excuses. It's been suggested this is an unofficial policy in hope that complainants will tire of the process and abandon it. Does the Minister agree that the Manx public deserves better service than this? And is he willing to have the matter investigated?
So in short, yes, if you've had any particular issues making complaints, please do let the department know and we can make sure they're looked into. We completely rejigged the whole complaints process actually towards the end of last year, introducing what's called the Health and Social Care Ombudsman body. So actually, if you're not happy with the way your complaint has been dealt with by Manx Care, you are entitled to make that complaint directly then to the Ombudsman body, who provide oversight of the complaints process. So if the complaints are taking too long, for example, if they're not being progressed in the right way, if you're not being involved or being kept informed, you can actually go up to the Ombudsman and ask them to investigate Manx Care's handling of your complaint in the first instance. So there is now some oversight which is a bit more robust than it used to be. So there is a body you can go directly to and say, actually, Manx Care aren't handling my complaint in the right way. I'd like someone to investigate it. That's exactly what the Health and Social Care Ombudsman body are there for. So I would strongly encourage anyone who's listening who's got a complaint in the system, in process, where they're not happy with the length of time it's taking for that complaint to be handled, to make sure you look on the website for the details for the Health and Social Care Ombudsman body and to escalate that complaint to them.
Sharon, good afternoon. You're live with Lawrie Hooper.
Hi, Andy. Larry, I want to ask a question in regards to the fact of me travelling to Liverpool to hospital appointments. I was there 2 weeks ago, and I stayed in the Stay Apartments hotel and apartments, and because I stayed there, I want to know why Manx Care won't give me money towards staying in the apartment, considering that I have to stay there for 3 days. I think because of my health, I deserve to have that little bit of comfort. And why also it takes 4 weeks to get a check back for a flight, why it's taking so long, and just why won't they help me and give me something towards staying in the apartment? But if I was staying in a Premier Inn room, they'll pay. So what's the issue there?
Without knowing the details, it's hard to know. My understanding of the way the travel reclaim process works, because I've used it myself, is you put in the claim and there is an amount they will pay for up to certain nights, but that's only if it's been determined that it was necessary for you to stay overnight in the first place. So some people obviously choose to go earlier and come back later. Some people, when they're going over to the UK, then decide to go onwards somewhere else. So it's not as straightforward as everybody gets the same thing. But I don't see, based on what you've told me at least, I don't see why you wouldn't be entitled to at least some recompense just because you've stayed in an apartment as opposed to a hotel. Ultimately, from a taxpayer's perspective, the same amount of money is going out the door either way. It shouldn't matter to us too much how a person chooses to spend that. So again, I'd suggest if you haven't had a satisfactory experience, I would suggest making a complaint or getting in touch with the MCAL's team, or again, if you want to get in touch with the department directly and put some of this down in email, we can have a look into it and see if there is a particular issue.
Well, I'm not on email, and I have already questioned this with Manx Care, and they told me they don't pay. And now I have to go back over, and I'm going to have to pay again to stay there because they don't do it. This is what I'm telling you.
And they won't pay a proportion of that, Sharon. Have they said that definitely?
They told me because I choose to stay in the apartment, they're not paying anything towards it. I was only over there a couple of weeks ago, and I've got to go back over again. She told me on the phone.
Okay, well, Sharon can make a call to... Who can she call, Lawrie Hooper?
So, like I say, you can call the MCAL's team. I think it's 642-642. They should be able to provide some more information. They should be able to look into it for you and see if you've been given the right information. If you can't get anywhere with them, pick up the phone to the department. I can't remember the department's phone number off the top of my head, but it's on the website. If you want to pick up the phone to them and actually ask the question, and then we can get in touch with Manx Care and see what the situation is.
Okay, all right, Sharon. I'll just find the number for you, and we'll tell you what that is. I just want to move on to another. This is a constituency one now, and this is from Derek, who actually lives in Macclesfield. However, it's considering the north of the Isle of Man. With the current review of heritage railways underway by the government, this is a sister report, and the Chief Minister hasn't publicly committed to the preservation of heritage railways. As a Ramsey MHK, with many businesses in Ramsey benefiting from the railway, are you committed to the heritage railways and to the MER, which of course finishes in Ramsey?
I think they're two very different questions. So there are people, I think, who want the government to commit to the heritage railways as they currently are in their current form, fully extend the horse trams all the way down and all the rest of it. I think that's a difficult commitment to make because I don't think the economic argument has been made for why we should retain the whole system as it currently stands in that way. Am I committed to making sure that we always have that kind of MER link into Ramsey as part of the system? I think I would say yes to that because I do see the benefit of having that link in and out of Ramsey for having the MER. One thing I would say though is I do think we need to do a bit of work on the tram station. It needs a lick of paint and a bit of tidying up. I've made that request to the DOI a few times, but I think there's definitely a piece of work to be done to say our heritage railways more broadly, do they work for us as an island, and what needs to change to make them more sustainable. But I would always argue that in order to be a true heritage railway network, it needs to still consistently run from Ramsey in the north right the way down to Port St Mary in the south. It needs to be that kind of network.
But what do you think about the horse trams?
Horse trams are another difficult one because I think I've always said that it's going to cost, I don't know, what is it, another £1 million or something, isn't it, to extend them to the end of the promenade. I think if the DOI can make an economic argument and say it's worth spending the money because it's going to generate, X number of tourists and Y number of pounds in economic activity, I'd fully support it. If, on the other hand, they come back and say, it's a nice to have, but actually it's not going to generate that kind of return, then I would struggle to support that, I think.
Okay, Sharon, by the way, the number for the central number for DHSC is 685-816, 685-816. Anne, good afternoon, Anne. You're live with Lawrie Hooper, MHK.
Good afternoon, Lawrie. Really, I'm just speaking on behalf of a couple of friends, really, who I've had to support, certainly over these last 10 or 12 years, through the health service when they've had issues. And my main concern, apart from misdiagnoses, is the lack of aftercare. Now, I need to ask, is Teresa Cope a doctor?
My understanding, I think Teresa's a radiographer by profession, but she is definitely the chief exec of Manx Care as well.
Yeah. Well, in fact, funny enough, I've got issues with radiographers from my own issues that I can only explain them to be possibly blind. But I don't want to talk about the blind radiologists that this island employs. I want to talk about my friends who aren't getting the support and the aftercare, because they've got, certainly one of my friends has Teresa Cope writing to her after she's had a cancer diagnosis, her lung removed, and then no aftercare, which Teresa, so she wrote about the aftercare issue, and Teresa wrote back and says, you don't need any, which is very surprising because on Section 23 of the National Health Service Act of the Isle of Man, Prevention of Illness Care and Aftercare, it clearly says that, it says the department may make arrangements for the prevention of illness, the diagnosis, treatment and care, and aftercare of such persons. So this word may, can it translate into we're not going to help them, or because people aren't getting any help? And back to this poor person who's misdiagnosed with cancer, had the organ removed, has been left because she doesn't need any aftercare, according to Teresa Cope. But now she's been diagnosed with TB, but we've got no TB specialists on the island. She's getting no care at all. And now to get out of it, they're going, oh, well, you haven't actually got TB at all. So this woman is in complete bits. She needs help. She's not getting it. She's now being stonewalled and gaslighted by her own doctors. So people are being left to die, Lawrie.
What's her GP had to say about this, Anne?
She's been gaslighted by the GP. I mean, I completely understand it. I've been gaslighted for the last 48 years by my own GPs. So with misdiagnosis, they just stonewalling and gaslighting is the only words that explain the GP practices to certain people.
Okay, Lawrie Hooper.
So I can't really talk about specific cases or specific issues, and I'm not a doctor, so I'm not qualified to comment really on any clinical matters. But what I would say is the decisions should be being made by clinicians, so the decisions around a person's care will be getting made by the individual GPs or consultants or specialists that are responsible for that person's care. If you or your friend doesn't think that they're getting the right care, the right thing to do there is to then make that formal complaint and escalate it through the process. And again, because we have an independent body now overseeing the complaints process, that should be dealt with in a fair and transparent way. So the first instance, you go back to the GP, go back to the consultant and have those conversations directly, because they're the people making the clinical decisions about the care that you should be getting and that your friend should be getting. But then if that still isn't satisfactory, you're not getting anywhere directly, then the next stage will be to make that formal complaint and escalate it through the process.
Okay, and thanks for calling today. We're with Lawrie Hooper, MHK, at 17 minutes before 1, a minister at the DHSC. Lawrie Hooper, I'm going to ask a question that many people ask. It's naive and it is a sweeping question. And the question is, and it came from texter 425, if the government can find money for the ferry terminal in Liverpool, why can't they find the money for the health services? I said it was naive.
I think if I had an answer to that question, I'd be in a different job getting paid a lot more money, I suspect. My understanding of the way that government finances work, and take the Liverpool landing stage as a good example, that was a project that was approved in the last administration, and two-thirds of the way through it or whatever, either you finish it or you've wasted the 60-70 million that's already been spent, so you have to finish that. Otherwise you're left without any kind of landing stage and without the money that you've already spent invested in it. In terms of the health service, that's kind of an ongoing revenue cost. So say we need an extra 30 million this year, we're actually going to need that every year. So it isn't like a one-off spend that you get with something like a capital project in this case, whether it's the landing stage, whether it's Cummal Mooar, it doesn't matter what it is, that's a one-off spend that you're only going to cost you once this year. But if we need 30 million for the health service over 5 years, that's a lot more than just a one-off 30 million pound. And obviously then next year there'll be more pressure, and the year after there's more pressure. So I think talking about revenue and capital spends in the same breath is slightly misleading. But actually the fundamental question that is being asked here is, why can't we properly fund not just our health service but our education service, our highways, our ports, everything? And ultimately it boils down to, we are a high service, low tax jurisdiction, and one of those two sides of the coin needs to change.
Lawrie Hooper, we're with through till 1. It's 1:45 now.
Have you visited the new HSBC branch yet?
What new branch?
Their new branch on Strand Street. Super convenient location, enhanced facilities, and the staff was so welcoming.
Great. Banking made easy. I'll check it out.
Our Strand Street branch is now open, so pop in, say hello, and find out about our open days. HSBC, opening up a world of opportunity. HSBC Bank PLC Isle of Man branch is regulated by the Isle of Man Financial Services Commission. Visit the HSBC website for terms and eligibility requirements.
There's a new way to Subway with 2 fantastic menus. Which will you go for? The all-new Subway series with 15 irresistible creations, like the Big Bombay Sub, great goddess salad, emperor wrap, and big cheesesteak sub-melt. Or create your own. You pick the ingredients you want and build your own sub, salad or wrap the way you want it. There's a great mix of healthy and indulgent menu items available from Subway and ShopRite, Peel and Port Erin.
Hospice Isle of Man's lottery is now bigger and better than ever before, with huge rollover jackpots of up to £10,000 and 32 guaranteed cash prizes to be won every single month for just £5 a ticket. What are you waiting for? It's the fun, easy way to support hospice and the people we care for. So sign up now at hospice.org.im/lottery or call 672222. Players must be 16 or over. See website for terms and conditions.
Sport has a new home on social media for Manx Radio, where you can keep up to date with all the latest sporting action on the Isle of Man. Our new dedicated Manx Radio Sports Facebook page is now live, bringing you all the latest sports news and features. So whether it's motorsport, FC Isle of Man, Manx football, rugby, hockey and much more besides. Make sure to like and follow Manx Radio Sport on Facebook for all the latest updates. On air and online, this is your home for sport on Ireland, the nation station, Manx Radio.
The Mannin Line with Andy Wint.
And Lawrie Hooper, MHK, is with us today. Just for the uninitiated, Manx Care split off from DHSC, was it 2 years ago now?
2020,
because of the Sir Jonathan Michael report. And just in words of one syllable, what was the fundamental reason behind that? Why split the two?
In part, it was to try and separate the actual decision-making around operational matters away from the strategy and the policy. The problem with the old DHSC was they spent so much of their time trying to deal with the operational day-to-day. They didn't have the resource or the focus to do the big strategic thinking. And part of it was around finances. So the thinking being that politicians are incapable of making difficult choices. And so when difficult choices need to be made, sometimes it's best to actually have a body who are professionals, who know what they're talking about, who can make those difficult decisions for the right reasons, rather than having politicians kind of wading in all the time. I'm not entirely sure that it's working perhaps perfectly as intended, but I think that was the original thinking behind it, at least.
Politicians incapable of making
difficult decisions.
Could you expand on that a little?
Yeah, so I mean, if you look at the way that our system works, because we don't have a party political system, you have lots of independents, and so ultimately when you have an issue that affects an individual politician perhaps more than the Isle of Man more broadly, you'll inevitably get the independent politicians doing what they think is right for their particular neck of the woods.
A constituency bias.
Yes, exactly. And I think in some ways that's not unhelpful and not unhealthy, because that is kind of our job as politicians, to stand up for our constituents. But equally, it's our job to make sure we're doing what's in the national interest. And sometimes I think it's easier for these operational arm's length bodies to make some of the detailed day-to-day decisions that might have impacts here, there and everywhere, without necessarily having politicians wading in and deciding, what flavour coffee we should be serving on the steam packet, or what colour the seats need to be on the new Manxman boat. It's that level of operational detail that I think was trying to be outsourced essentially to people that, in theory at least, are the experts. They know what they're doing, and let the politicians deal with the policy and the politicians' side of things, and the stuff that really should be our remit. And that was the logic, I think, behind the split.
A message in now from, well, actually lots of messages regarding dentistry. One's from Hayley, who says bluntly, are we all going to have to go private in the end? And James, who just said, isn't it a fact that due to poor procurement and poor choice of contract providers, DHSC has destroyed NHS dentistry in the Isle of Man? Part of this isn't historically clawing back money from dentists who underperformed and wasting millions of pounds that could have been put to good use, and even giving the NHS dentists huge pay increases when they haven't met their KPI.
So my understanding is that in terms of clawbacks, dentists get paid for what they deliver. So if they do underperform to the contract, that balance is then recovered by the department, or in this case by Manx Care. There is a new dentistry contract in place now, actually, which I think 3 providers have signed up to. And the thinking behind that new dentistry contract is to try and drive demand in the right way, to try and fix some of the problems that are inherent in the old contract. But not all the dentists have signed up to it. And I think inevitably this is the problem you're going to get with a privatised model is that you are reliant on the private sector actually doing its part and wanting to change, whereas if, for example, what they have at the moment works for them, there's no real financial incentive then for them to jump ship onto the new contract. And so I think things are gradually starting to change, but it is definitely fair to say that dentistry, like a number of other services in health, has been underfunded over the years. Disparity in terms of regional provision, so there are some areas that have much better NHS provision than others. There's more availability, but broadly speaking, there isn't even enough NHS provision across the island to meet the demand that's there, and that will need, again, long millions to be invested in it to bring it up to scratch.
Historically, there was good dentistry on the Isle of Man. So, is the Isle of Man is it a particular problem for the Isle of Man, or is it more widespread? Is it more common elsewhere?
So I think it's the same problem that you're seeing in other jurisdictions, but other parts of the British Isles. It's difficult to recruit dentists. It's an expensive system. In the UK, obviously, you've got a government historically that's trying to move more towards that kind of contracted, commissioned, private model. It's not necessarily the direction of travel that we should be going in. From my view, I think public services provided by public service is probably the right way. So I think we're sort of caught in a net, and again, it's decisions that have been taken in some cases years ago, and now we're only just about now starting to see the consequences of some of those decisions.
Helen, good afternoon. Helen, you're live with Lawrie Hooper, MHK.
Hi, I just wanted to give you my experience of the NHS recently and how I appreciate you going over budgets, but there is so much money that could be saved by stitching time saves 9. My experience is I have lived with a cancer for 13 years basically, and I've lived well. I've cycled, I've swam, I've done everything I can to stay fit, and you would never know there was anything wrong with me until in March I was taken into hospital because of gallbladder problems that were caused by the cancer medication. And basically I was in, and then I was sent home, and I was back in again, and the general gist of it is I got sepsis. I got kept in hospital for 6 weeks. They couldn't get me across to Aintree to get the gallstones out that were blocking the ducts. They eventually got me over. I was dealt with, brought back to the Isle of Man, was told that my gallbladder would be taken out within about 3 weeks, and here I am now. That was the 29th of April. I've got a provisional date for the op now for the 15th of August. I've been in and out of hospital. Last week I had to go in to have nasal tube put in to feed me because I have had permanent diarrhoea since the problems with the gallbladder, and I think what has been spent on me in the meantime could have been, if I had been given the gallbladder operation, and I would be recovering now, but instead my kidney function, which was damaged by the sepsis, my joints were damaged by the sepsis. I've gone from the morning of admission swimming in the sea at 6:30 in the morning and then doing a mile in the pool to hardly being able to walk to the top of my drive, and it's frustrating, and it's just, I think if people are going to come and live on the Isle of Man, you've got to make it better for those who are trying to stay healthy and trying to do the right thing. I just feel like I've been totally abandoned. I keep getting called into the doctors because my kidney function is, I think it was down to 38% now, and I worry that I am not going to be able to be fit enough to have that gallbladder operation because it's been left so long. Because it has been left so long, more stones have escaped from the gallbladder now, it would appear. That's what the medics seem to think because of my symptoms, and I feel like I've been totally written off.
I'm really sorry to hear about that experience. That is not the way the health service should operate. You should be able to get in and see people within a reasonable time. You should have operations within a decent time frame. Everything you've described is just... You've just described perfectly, actually, how the system shouldn't work. It should be better than it is. The only thing I would say, though, in terms of talking about overspends, most of what you've described, if you'd been seen quicker, if you'd been seen properly, it probably wouldn't have saved a great deal in terms of cash, in terms of money, because somebody else would have just got in to use the services that you were otherwise occupying. So what you're really talking about there is huge inefficiencies. So we could have, you're absolutely right, if you'd have been seen quicker, if you'd have had the operation quicker, then somebody else could have been seen by all the doctors' appointments that you've taken up and all the time in hospital that you've spent. Someone else could have utilised that resource. So what you'd have actually seen is more people get treated quicker for the same amount of money as opposed to actually saving any money. And so you're absolutely right. That isn't an acceptable level of care. You should definitely have been seen quicker. Everything should have worked. You shouldn't be feeling like you've been abandoned by any stretch.
When are you likely to have the operation, Helen?
The complication is because I can't go back on my cancer medication until I've had the gallbladder out. So all of the time I've got a ticking time bomb inside me, and I still look a fit, healthy woman. I've lost 3 stone, which I'm glad I had a little bit to lose, to be honest with you. But I have tried so hard, and I've fought this disease and lived really well with it, and I just feel like I have been sold down the river.
Have you been given a date for the operation, Helen?
Well, I have been given it verbally as the 15th of August. It has to be done in Liverpool because of these tumours that I have inside me. They can release hormones under anaesthetic, so they have to give you a flood of a drug called octreotide before they do the operation. So it has to be done in Liverpool, and it actually was due to be done in Liverpool before COVID struck. But I understand from my own GP in Ramsey that we are falling well behind in what we expect from Liverpool, in that the Isle of Man seem to have a bit of a backseat at the moment, and Liverpool are dealing with their own backlog, and the Isle of Man are kind of being put to the back of the queue.
Okay, Helen, thank you for giving us your story today. We really appreciate it, and we hope everything gets to some sort of conclusion, well, the conclusion that you want. That's it. We're out of time with Lawrie Hooper, MHK, today. Thanks for being with us. Appreciate it.
Thanks very much for having me.
Okay, just a quick word on this. If you've got 20 seconds, you mentioned a high service, low tax economy, and you felt that it looked like you were going to say something else about it. What's your thoughts on that?
Well, my view, for what it's worth, Andy, is that isn't sustainable in the long term. I mean, if you want high levels of services, we have to fund them properly, and I think what you've heard from all your listeners that have called in today has been a very consistent theme, which is people actually have a right to expect a good level of service, a high level of service, but ultimately what that means is we have to be willing to find a way of paying for it. You can't operate a system, in my view, where you've got constantly telling the public service, constantly telling the health service, constantly telling the staff in the service, sorry, there isn't any money for you. It doesn't work.
All right, thanks for being with us today, Lawrie Hooper. And this coming Thursday, Chris Thomas, HK, is on Mannin Line. Thanks to Chris Quirk on the phone.